Hello, sir. Please, can you tell me about the management of hypertension?
Okay, welcome to today's addiction. Hypertension, like we started in our previous series, can be properly managed if it is early detected and the prompt management is taken, medical management is taken. There will be better prognosis, hence less complications such as angina pectoris, such as cerebrovascular accidents, such as coma, such as myocardial infarction and heart failure, such as renal failure, and chronic pulmonary obstruction and probable death. However, this disease, hypertension, which is a silent killer, it has been classified by World Health Organization as a global emergency and a silent killer. It can be managed primarily, um, has two management. One is pharmacological, which we will take one after the other, and the other one is non-pharmacological. What are the non-pharmacological management of hypertension? One is reduction of stress. You don't have to be doing jobs that exposes you to overstress, like physical overactivity, like some certain jobs that come with some hazardous occupations, and people that work in places that keeps them stressed and tensed up. You don't have to be doing that. Another one is sedentary lifestyle. There are people that do not exercise, just like what I'm doing now. My body is removing toxics, removing metabolic waste, excreting them from my system. There are some people that do not do that. The only way they remove toxic metabolic waste product from their system is through maturation, that's urine, and through fecal excretion. Now, the import of that is that you should be doing at least mind exercise, and to keep your body relaxed. Like what I'm doing after this, I'll have my bed and have a normal a little rest, to relax my nerves, to relax my muscles, to relax my life, and it gives me a better outcome. Then there are people that also are obese. Once you are obese, or you are adding, you notice you're adding excessive weight. Like in the case of obesity, there is an indication of accumulation of fat known as atherosclerosis, which is the accumulation of fat in the lumen of the blood vessels. So if you don't burn out these fats, it can also affect you, and you do that through exercise and through dietary management. You don't take excess of refined foods and the oil. Then people that are also diabetic, you don't take too much refined sugar. So there are also, you are expected not to take too much of those things. There are also people that are chronic smokers, and the people that take excessive alcohol, because of course the body produces the quantity of alcohol that it needs. So excess alcohol in the body is not actually good. Okay, there's another factor, which is genetic predisposition. There are people that this runs in their families, and that is why early detection is a key, a fantastic approach to the management, non-pharmacological management of hypertension. So you've got to be checking your blood pressure from time to time. Then coming to the pharmacological management of hypertension. Like I said, hypertension is better managed with early detection. Uh, so there's a lot of drugs to be taken. We're going to be taking them one after the other, but because I want this video to be very, very short, I don't want it to be very long. I will take one today, and we'll take it consecutively. We'll be taking them one after the other. The first drug to be used here is calcium channel blockers. Calcium channel blockers. So these calcium channel blockers has other classes like amlodipine Basalate. When you go to buy this medication, you don't just buy amlodipine, you buy amlodipine Basalate. There's another type too, known as felodipine. There's another type known as nicardipine. They are also in the same. They are all in the same group. What does this drug do? This drug tries to block the entrance of calcium, to the bloodstream and possibly to the heart, thereby reducing excess calcium to the heart, leading to high blood pressure, and also try to relax the blood vessels. So this is the work of this medication. It is usually used in prompt management of this. It's a common medication in the management of hypertension to give immediate result. It is a very, very effective drug. Route of administration, it's orally. It's taken orally. Amlodipine Basalate or its types like the nicardipine and others are taken orally. One tablet daily containing it can be titrated. It can be titrated, and also it can also be given in combination with other medications like lisinopril, like Valsartan. But when we talk about these ones, we will talk about cases where it can be given in combinations. So they are giving 5 to 10 doses daily. They are giving 5 to 10 doses daily with copious fluid intake. When we say copious fluid intake, we are talking about 3 liters of water per day. The person has to take about 3 liters of water daily, but you have to take this medication with enough water, enough fluid. Okay, like a glass full of water. You don't just chew this medication. You don't just take it with little water. No, you have to take enough water to enable. The reason for this is to enable renal clearance. This medication, they don't have to go to your kidney and start forming stones, because when you take excess medication, when you take too much medications, what they do is in most cases they start forming stones known as nucleation in the kidney. So you have to take enough water for proper renal clearance and drug metabolism, so that they don't cause you either kidney stones or they cause you liver cirrhosis or liver diseases. So that is the import of that. For renal clearance and proper drug metabolism, of course, you know that every 80% of the drug that you take orally metabolizes in the liver. So this medication is contraindicated. That's people that are not supposed to take this medication are children, lactating mothers. That's people that are, in fact, it is better taken. This medication is better taken as prescribed by a physician. So you have to, and that is why I made mention of early, I made mention earlier that you have to go to hospital for checkup. So your doctor have to prescribe for you according to your medical history, the kind of medication and how to take this medication. You don't just take this medication anyhow, because there are other factors to be considered, like if you are a diabetic patient, if you are a patient with chronic pulmonary disease, if you're a patient with liver disease, if you're a patient with renal disease. So this medication should be taken as prescribed by a medical licensed medical practitioner. Don't go to chemist store. If you must get a drug in the pharmacy, it has to be as prescribed by a licensed physician. So what else do you need to know about this the management of this of this hypertension is, if you do not, I talked about early detection, I talked about prompt management, I talked about prognosis. Prognosis is the outcome. So if you do not detect this medication early, if you don't detect it early and the prompt management is taken, the prognosis is that you are going to have some complications. Complications like cerebrovascular accident, which is stroke, complications like myocardial infarction, which is cardiac arrest, complications like liver cirrhosis, which is inflammation of the liver, complications like renal disease or renal calculi, which is kidney stone, and then complications like complications such as coma and probable death. So until we see you again, we'll talk about other pharmacological management of this disease. Thank you.